So Dr. Drake, for the viewers, perhaps you could walk us through the analysis process of this case?
I'd love to. First, it is always imperative to isolate the symptoms pertaining to the location or pain experienced. Even to find out the nature of the pain as felt by the patient regardless of the disease classification. So we see here, the physician is explaining what she needs to know.
First, what circumstances or situations affect the back pain?
And here we see the first of the answers pertaining to the problem.
I see.
Well, if it's cold, I feel it a lot. Cold does not agree with my back at all. Well, I also notice as if I sit in a chair, I can't get comfortable. I have to kinda slouch a bit.
You mean like when you sit straight in the chair it's uncomfortable?
Yeah. Like now I'm sitting here and I keep shucking down to take off the pain.
Now here you see the physician looking for symptoms that the patient has observed, but might not have an obvious connection with back pain.
Well, there is something that is happening of late. Been meaning to ask about it. I am a builder and I notice that if I concentrate hard on something, and look at it, my eyesight goes a little strange.
We see that the physician double-checks if the symptoms the patient describes happen at any other time or circumstance.
Any other time you get this eye issue?
Well, yes.
Yes?
Yes. Well, if me and the missus, do married things, I've noticed it affects my vision after.
The same type of visual disturbance as when you look at something for a while or concentrate hard on it?
Yes.
So now we have all the details necessary to make a diagnosis in homeopathic terms. Let's go to the clinic to see what was chosen. So here are the patient's notes. Let us see what was considered important for using as altered and changed symptoms. First, I see that sitting upright aggravated and that sitting slouched or bent made it better, so that was entered into the repertory. The next symptom, a condition or modality that affected the patient both generally and locally, was that cold affected him and his condition. We see the next issue that the patient complained of was that his vision caused a problem when he looked intently at something. The vision also was disturbed after sexual relations. So when we compile these symptoms together, we see that the medicine of choice would be colicarb. We never prescribe without confirming the symptoms in the materia medica, and a lot of other symptoms that was noted but not included in the video was also produced by the medicine. Joe is now clear of his backache and his vision has improved.